We are covering a crucial topic for your phlebotomy exam: techniques for geriatric and other hard-to-draw patients. The exam will test your ability to adapt standard procedures for this population, focusing on safety and sample quality. Geriatric patients often have fragile, rolling veins due to decreased subcutaneous tissue and collagen. The most critical first step, and a common exam question, is to anchor the vein firmly with your non-dominant thumb from below the intended puncture site. This prevents the vein from moving during needle insertion. An exam trap might present a scenario where a phlebotomist fails to anchor, leading to a missed vein. You must identify this as the error. Another key adaptation is reducing the angle of needle insertion. Because these veins are often more superficial, a shallower angle around 10 to 15 degrees is necessary to avoid puncturing through both sides of the vein. The exam will expect you to know this is a deviation from the standard 15 to 30 degree angle. For equipment selection, always opt for a lower gauge needle, such as a 22 gauge needle or a 23 gauge butterfly needle. A question might ask you to choose the appropriate device for an 85-year-old patient with fragile hand veins, making the butterfly needle the best answer. Post-procedure care is also a major testing point. Geriatric skin is thin and at high risk for tearing. After the draw, be gentle when removing adhesive. An exam scenario could test your knowledge on using non-adhesive wraps or paper tape to prevent skin trauma. Finally, communication is key. Exam questions may involve patients with hearing or visual impairments, requiring you to demonstrate how you would ensure they understand the procedure. To remember these critical steps, use the mnemonic GRASP: gentle angle, reduce gauge, anchor firmly, slow procedure, and patient communication. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.